mandate. Gone are the days of weak, feckless, America-last leadership from the Oval Office. The American people are sick and tired of the radical left forcing its woke policies into every facet of our lives.
We need to completely dismantle the Minneapolis Police Department.
We're coming for them. We're coming for your children.
President Donald J. Trump is working tirelessly to implement the America First policies that you demanded. And I'll be by his side all the way.
Biggs, where's Andy? Boy, oh boy, there's a guy. He's tough.
America's golden age has arrived. It's time to make America great again.
Hi, this is Andy Biggs from Arizona's 5th Congressional District. Thanks for joining me for another one of my semi-regular editions of What's the Biggs Idea. And I think it's time to make America health-free again. You know, give us health freedom back in America. And so I am so honored to have my special guest, Michael Cannon, the Director of Health Policy Studies with the Cato Institute. Michael, we did stuff together back, I want to say 2017. We were trying to get some stuff done then. It didn't ever really work out for us. He specializes in health and medicine policy, from the regulation of clinicians and medical facilities to medical malpractice litigation and international health systems. He's appeared as a health commentator on national and international outlets, written several articles and books about healthcare reform through the free market, and served as a domestic policy analyst for the U.S. Senate Republican Policy Committee. Michael has been described by the Washington Post as an influential healthcare wonk, and by the Washington Examiner as the most famous libertarian healthcare scholar. But I know him as a guy who really just knows a lot about healthcare, has a lot of incredible ideas, understands this, studies this, focuses on it. I value what he has to say, and that was one of the reasons I wanted him back on to join me today. So, Michael, thanks for joining me. I'm glad to have you.
Great to be here.
So let's talk about this. Every year, Americans are hearing that healthcare costs are rising. And in fact, they seem to be rising, right? But many people still don't understand why this system feels so broken. From your perspective, what's the biggest structural problem in the U.S. healthcare system today?
That's an easy one. Well, we end up spending $6 trillion on healthcare per year. That's the estimates are for this year. And the wrong people control that money. The OECD says when it comes to government control of health spending, the United States is closer to communist Cuba than the average OECD nation. That's because in the United States, the government controls about 83% of health spending through taxes, as well as compelling you to spend your earnings in the private sector the way the government wants. And so that money follows political imperatives. The political preferences of ideologues in Washington, D.C., special interest groups in Washington, D.C., who want you to buy the healthcare and the health insurance that they want, who want you to pay the high prices that they want you to pay. And so we don't get the benefit of consumers making choices based on their values, directing resources to the lowest price providers and insurance companies, a process that makes healthcare continually more affordable. And instead, we get rising prices, often unconscionably high prices, not just in the private sector, also in the Medicare program and the Medicaid program. We get gaps in our health sector where people keep falling through because they lose their coverage when they lose their jobs, or Obamacare encourages their insurance plan to drop their cancer center or their doctors or what have you. And instead of getting better, more affordable, more secure healthcare, we get healthcare that is expensive, gap-ridden, and we have people falling through the cracks. What we need to do is change who controls the money. As the president said, we need to let the consumers control the money. The way he's talked about doing it through Obamacare, I think, is a bad application of a good idea. But we can do it in the private sector, move 1.6 trillion of that $6 trillion away from employers, give it to the workers who earned it. That's how much employers and workers are going to spend on employer-sponsored insurance this year. But if the workers tried to take that money and buy the insurance that they prefer, the government would tax them. We need to eliminate that tax penalty on workers controlling their own money. Let them control the $1.6 trillion. And I know this will warm the cockles of your Republican heart. That would be a larger effective tax cut than the Reagan tax cuts, and larger than any tax cut that Congress has passed while you've been in office. That's about 5% of GDP, where no tax cut that you've ever voted on has exceeded, I think, 2% of GDP. So we can do this, and that will tame the health sector. It will get us more affordable health care, and that's just where we start. There's still a lot more to do.
Yeah, that's awesome. I'm glad you went that way, because the money issue, I mean, it always starts and ends with money. Who controls it? Who's getting the money? Who's incentivized by the money? Who's making the trade-offs? And what we see is, this notion, the way President Trump sells it, he says, give the money to the people instead of the insurance companies. And the way I've always interpreted that is, let the people make the decisions with the money, and then basically watch the regulatory reform that you have to have. So I want to throw something at you, because I hear this a lot here in Congress. There's no appetite for these people to get rid of Obamacare, to be frank with you. They just, I don't think we can get the votes to do it. But what you can do is you can actually move, like you say, outside of that Obamacare pathway, and you create this other free market pathway where the money goes to the individual. They're making the choices. Insurance companies then, at that point, they can do short-term insurance. They can allow you to move products across state lines. I mean, all of the things that would actually be indicative of people having healthcare choice. Because when we talk about healthcare, mostly what we're talking about is insurance. It does not, in some respects, it has very little to do with the quality of healthcare and the cost of healthcare that you and I want to get.
I've criticized the president when I thought he deserved it. I've praised him when he deserved it. One place that I've criticized him is when he says we should use that concept of give people the money and apply that to Obamacare. I think that's, as I said, a bad application of a good idea. That would cause Obamacare to expand and increase the tax burden of the program and deprive more taxpayers of their money. We should be leaving the money with the taxpayers. The way I proposed reforming employer-sponsored insurance a moment ago is one way to do that. And we can also do this in the Medicare program, because that's a universal program with seniors. You're not going to expand Medicare or expand Medicare spending if you give seniors the cash. But if you give seniors the cash in Medicare, you'll circumvent the insurance companies and you'll force them to compete. I think it does work there. And as for Obamacare, again, this is an area where I've praised the president, because what he did in his first term by making Obamacare exempt plans more widely available, allowing them to offer more consumer protections, that's the way to make health insurance more affordable for people who are struggling to afford Obamacare right now. Those plans, Obamacare exempt plans, the CBO said that they're comprehensive. They often have lower deductibles than Obamacare plans and cover more providers than Obamacare plans. The CBO also said their premiums are 60% lower. So if the president, or this isn't really a job for the president right now, this is a job for you in Congress. Yeah. What Congress should be doing is taking the relief that the president made, the temporary relief that he offered in 2018, from 2018 to 2024, and making that permanent, letting people buy Obamacare exempt plans at premiums that are 60% lower. And then if you do that now, a lot of critics will say, well, that's going to hurt Obamacare. Obamacare premiums will rise and enrollment will fall. But Trump's rules were in place for 6 years. Obamacare premiums didn't rise. They remained flat. And Obamacare enrollment didn't fall. It went up during that period. So there's no reason for Congress not to do this. This is a short putt. Congress should be doing that before the midterm elections. so that people, because as soon as Congress does that, people will be able to buy those plans immediately, even outside of the so-called open enrollment period in Obamacare. They'll be able to get the coverage they want when they want it.
Yeah, and that, I'm sure you can tell us how is that, how does the public respond to that? I mean, if you can get your own insurance, you can get money. And look, one of the things that you're talking about is one of the things that I've talked about, and I've got in some of my legislation. That is, you treat the money that an individual or a small self-created group spends on health insurance the same way with the same kind of tax break that you give to employers. I mean, why are we taxing an individual who wants to make those choices themselves?
So that makes no sense at all to penalize people if they for the crime of wanting to make their own health decisions. They have a right to make their health decisions. The government should not be taking that away, either in toto or in part by penalizing them for choosing better health insurance. And how do people respond to the idea of being able to buy Obamacare exempt plans? Well, millions did when President Trump expanded those opportunities in 2018. When you ask them in polls, do they want the right back? Do they want government to restore their right to buy health insurance year round whenever they want, instead of in a narrow window at the end of the year, like Obamacare says? Yes, they overwhelmingly want that. And when you ask them, what about Obamacare's pre-existing conditions rules? Do you support them? They'll say 2-1. They'll say yes, until you ask them about the costs. And when you ask them, what if it reduced the quality of health insurance? What if it meant that you couldn't have MD Anderson Cancer Center in your health plans network? And by the way, not a single Obamacare plan in Texas covers MD Anderson. When you ask people, what if those rules reduce the quality of coverage? Support flips to 2-1 opposition. And that is a very real problem that has happened to a lot of people in Obamacare. They have had their access to care cut off because Obamacare penalizes broad networks, penalizes plans that offer the best coverage for the sick. And over my shoulder, you'll see a picture of a young woman, lives in Virginia. Her name is Colette Briggs. She's a leukemia patient whose parents had to fight over and over again against these perverse incentives that Obamacare created for the insurance companies to drop her cancer care. So the public opposes Obamacare's approach to providing health care to the sick because it fails. Obamacare is junk coverage. They support the freedom to buy comprehensive coverage at lower premiums year-round with the kind of coverage that's tailored to their needs rather than the needs of the ideologues and the special interests in Washington, D.C.
Well, I mean, I'm glad you brought that up because, I mean, you're talking about incentives again. And Thomas Sowell always talked about what is a market. It's all built on incentives and trade-offs, right? And we're making a huge trade-off. The huge trade-off we're making in Obamacare is good quality healthcare at an affordable price. So we can say what? I mean, what is really the ambition and the purpose of Obamacare anymore?
Obamacare is doubling premiums for most enrollees. That's what President Trump showed when he made access to Obamacare exempt plans available. And when he did that, again, Obamacare premiums didn't go up and enrollment didn't fall. There's absolutely no reason for Congress not to make that choice available to people. And this idea has a bipartisan pedigree, because in 2014, when U.S. territories went to the Obama administration and said, look, if you let these rules take effect in our health insurance markets, they will destroy our health insurance markets. Please exempt us from these rules. President Obama did. He gave the territories relief from Obamacare. And so Obamacare's worst regulations have never applied in U.S. territories. I mean, the threat of them applying was enough to drive insurers out of the market. They just started coming back in recent years. But that means that Obamacare relief has a bipartisan pedigree. So Congress should not just codify and make universal and permanent President Trump's health insurance relief with regard to short-term plans and turn them into long-term plans. Right. But Congress should also tear down the barriers to trade between states and territories so that people in Arizona and Texas and Florida And Virginia, where I live, and all 50 states can buy Obamacare plans from U.S. territories from the same insurance companies that are already selling in your state and already have networks in your state.
So I'm going to go through different aspects of healthcare. What are the incentives? In my view, they're almost always perverse because they're skewed. They're directed through policy choices that are not really good. So the insurance companies, I mean, you touched on this. Their incentives are basically, they're not going to give you the best care at the lowest premiums. They're like you said, there's no MD Anderson Cancer Center in Texas. What are the incentives? What do the insurance companies say? I know what President Trump says. President Trump says it's all about cash, and and they're making money, and the incentives for the shareholders, which are seeing the value of the stock go through the roof, and that's because partly, I suppose, we have a captured system. So tell me, where do you see the incentives for the insurance companies?
They face, they have sort of the same values as most people. They prefer more money to less.
Yeah.
But the problem with our health insurance markets is that the government has distorted the incentives that insurance companies face. So they don't make money by giving people the health insurance that they want. They make money by gaming the rules that the government put in place and lobbying to change those rules in their favor. And that's what they spend money doing, rather than competing to provide consumers the most secure and affordable protection that they can from the financial cost of a long-term illness. Take Obamacare, for example. One of President Biden's economic advisors, an economist at the University of Texas in Austin, his name is Michael Caruso. He looked at what happens in Obamacare under Obamacare's supposed protections for people with pre-existing conditions. What he found was that even though Obamacare tries to prevent this from happening, as a result of those rules, the multiple sclerosis patients in Obamacare plans file about $61,000 in claims, but the plans only get $47,000 because of Obamacare's price controls in place. And even though it creates subsidies to make up for the perverse incentives in those price controls, they still only get $47,000. Okay. So every MS patient costs them $14,000 more than they receive in premiums. What are their incentives? Are they going to offer the best MS coverage? They can't, because then all the MS patients will come to them and they'll take a $14,000 hit for every one of them. So their incentive is to make their coverage worse than the MS coverage for their next closest competitor, so that all the patients will flock to that second insurance company. One senator said to me, like a swarm of locusts, they'll descend upon that second health insurance plan. And then that health insurance plan has an incentive to make their coverage worse than their next competitors, and so on. And that creates a race to the bottom, which is why MD Anderson is not in any of the Obamacare plans networks, because they can't, it's not sustainable with Obamacare's pre-existing conditions provisions in place. It is sustainable if you don't have those in place and you let people buy insurance when they're sick or when they're healthy at low premiums. Then they will be able to have guaranteed access to those providers at healthy person premiums even after they get a cancer diagnosis.
It's an amazing thing. It's a perverse incentive, and it provides worse care for higher premiums, and it's just this weird system that's distorted all over. Okay, so this leads to the other question on incentives. So you have providers. What's the incentives for the providers today? I mean, because when I talk to providers, there's a rash of them leaving the profession, not necessarily for Obamacare, but for some instances Obamacare, some instances Medicare, some instances Medicaid, and we have fewer people. We have fewer people going through med school. So, and that may be partly a demographic issue as much as anything. But what are the incentives for the providers?
I think that healthcare providers, be they clinicians or hospitals and hospital executives, are like insurance companies. They want to help people, and they'll do it to the extent that they can make money do it. You let them make more money helping people, they will help even more people. But again, providers are not facing market incentives because it's not the consumers who are controlling that money, it's the government. And so they're what's governing their business models and their even how they practice medicine are political incentives. So in a marketplace, you would have open competition between all ways of organizing medicine and paying for medical care. You would have Kaiser Permanente on one extreme, and you would have fee-for-service insurance companies, maybe, I don't know, United Healthcare on the other extreme. Over in Kaiserland, they're all part of the same system, like a school, and over in United, they're all sort of fragmented, almost like homeschooling. And you'd have open competition between the two of them, and no way of paying for healthcare encourages doctors to provide all forms of high quality care. Over here, yeah, they get paid more for doing more, and so they'll provide you all the medical care you need, and even some you don't. So there's good incentives and perverse incentives, but over here, they'll avoid the unnecessary stuff, but they also have an incentive to pare back on the necessary care. Open competition between both disciplines each of them and forces them to improve on the areas of dimension where their inherent payment systems are weak. That's not what we have in the United States. In the United States, the government has all but blocked this model over here. So the Kaiser is the only one that survives. So we don't get coordinated care. We don't get electronic medical records. We don't get medical error prevention and all sorts of other things that model provides. Instead, we get this incredibly complex system with surprise medical bills and information that gets dropped between providers and patients getting conflicting messages, and it's incredibly confusing, and it also ends up being more expensive. And the reason that, some people say, well, the problem is fee for service. The problem isn't fee for service medicine. The problem is government. That government is favoring one model over another. We need government to pull back and have open competition between all of them, because that is what will force the health sector to improve on affordability and on the quality of care.
Well, and so that leads to this, something I jotted down early in your conversation. What we're talking about today is what about the patient's incentives? They have been so distorted and actually, quite frankly, suppressed in many instances, because the incentive of a normal market system is for me to go out and get the best product I can for the most reasonable price that's affordable to me. But that's gone. That incentive is actually gone, and it's so distorted that I think the average American person, when they look at it, because you described it just a second ago, saying it's an incredibly convoluted, complicated system, it becomes overwhelming, and basically the incentives are lost, and you feel coerced or funneled to whatever, whatever's in front of you that's easiest for you to just obtain. And that is the wrong way for someone to be able to choose the best healthcare for them, their family. So what's your thoughts on incentives for individuals and families?
Well, the first thing that happens to every taxpayer in the United States is they lose control over their healthcare spending, because the government compels us to spend about 14% of national income, 14% of GDP on healthcare. That is a larger share of GDP than total health spending in any other advanced nation. So 14% of GDP, part of that is taxes you have to pay to the government. Part of that is the amount that your employer withholds from your salary to pay for your employer-sponsored health insurance, and another part is part you pay directly, and you end up losing control of a sizable chunk of your earnings and the ability to decide how to spend that money on health insurance. The government compels you to enroll in employer-sponsored insurance, which is riddled with gaps. As soon as you lose your job, you lose your coverage. Okay.
Yeah, how about
so
this?
You don't have. Go ahead.
I was just going to say, and the employers themselves they have some odd incentives as well, because normally because it is so expensive now for an employer to provide health insurance that you're basically diverting what otherwise would be a higher salary or earnings for the individual employee. They're getting squeezed out as well. I mean, the employee's getting squeezed out because the employer now is saying, well, I would pay this guy, let's say $80,000 a year, but I know I'm gonna have to pay 25 grand to 30 grand for his health costs, because there's been this skew on and raising of costs everywhere. So I can't afford to pay him 80. I can afford to pay him 50, where I would rather pay him 80 or 70 and have a lower healthcare cost.
Yeah. So if your labor's worth $77,000 per year, but you want family coverage from your employer, then your employer has to drop your salary. They can't pay you 77 in cash. They have to drop your cash salary wages down to 50,000 or 57, so that they can take 20 and apply that to your premium. And the upshot, though, is that you lose control of about a third of your income. And it doesn't really cost the employer anything. This is an important part, because the employer would have to pay you 77 even if it wasn't offering you health insurance.
Right.
The difference is you would have to pay taxes on that 27, and so you demand health it to you.
Yeah, Michael, I want to, before we go, I want to ask you one last question, if I can, and that is with regard to a bill that I introduced called Putting Patients First Healthcare Freedom Act. We discussed it briefly before we came on. Is that moving in the right direction, that bill itself?
I think that what it's trying to do is it's trying to let the consumers control the money in our health sector. And there are steps we need to take in that direction. That bill talks about doing it through health savings accounts, flexible spending accounts, health reimbursement arrangements. They're all sort of trying to move in the right direction, but they might risk expanding the distortions in our health sector. And I think there's a way to reform the tax code that reduces the amount of distortions that it introduces into healthcare. I call that idea universal health accounts. I think it might have bipartisan appeal, but that bill is at least moving in the right direction. And I think President Trump is moving in the right direction when he says what he's been saying about letting consumers control the money. So I think it's directionally right, although I might go about it in a different way.
Well, everyone that's watching, I thank Michael, because Michael is an expert in this area. I learned so much whenever I talk to Michael. And Michael, thanks for taking time out with us today. And we're going to have to keep going and keep pushing. I personally think that this needs to be the next thing after the Save America Act. The president wants the Save America Act. Well, I think we need to do something on healthcare immediately as well, and have been pushing for this for some time, and I know you have as well. So I thank you again for taking time, and I thank everybody for joining us. And please join us again on another of our semi-regular podcast of What's the Big's Idea. Thanks for being with us today.